Dr. Rameysh. I'm a breast radiologist and I work here locally in Singapore.
Yeah, I'm Dr. Theresa from the Philippines.
Hi, I'm Hollie. I'm a radiologist in Singapore.
I was very happy to participate, and I'm always happy to support BIE. We could learn from one another actually. I learned a couple of very important biopsy tips, even though I was conducting biopsy myself, which was very useful.
And I've always been a part of BIE since 2019. It felt like it was a Christmas party. So I think I found it enjoyable in that sense. And I love meeting new people, making new friends, and sharing a bit of the knowledge to make it that they can learn a bit of the refinements in what we do in our local practice, and hopefully also pick up a few tricks here and there, and that makes all of us like better doctors.
I have actually been as a participant to this course before many years ago, in 2018 I think, when the first one was when it first started. And now Nikita has invited me to come back to share whatever I have learned with the rest of the candidates. So I actually do quite enjoy sharing my knowledge and tips and tricks, especially for performing procedures.
Well, for me, basically, since there's a lot of options for ultrasound guided biopsy, I thought it was just good to start with like geometry, so that everyone has at least some sort of a basis, and some of them actually shared that it helped them get over their fear of performing biopsies on their own, or even attempting difficult biopsies, which I think was personally very satisfying and very encouraging, that it makes you want to teach other people to also gain a few more skills.
I was conducting the MRI intervention workshop, and basically it involved a short talk on how to do the procedure, not only on theoretical grounds but also on some of the tips and the challenges you may encounter. We were doing vacuum and wire localization on MRI guidance, and the hands-on portion of the whole session I think was what was appreciated by the participants. It sort of brought MRI biopsy a little closer, especially to radiologists from around the region who's not so familiar with MRI biopsy. So there was good interactions from the participants. I think that a lot of people were interested in that one, so that was a good experience too.
I was helping out the ultrasound station, so I was conducting the vacuum-assisted biopsy, and it was quite interesting to share with the other people how to use the system. They actually even asked me other questions like how to give local anesthetic and what would I do, and just chatting to them, we realized that quite a few of us actually have the same sort of techniques and tips to share with one another.
Awesome.
I think it's actually quite a good program. It's considering that there are several modalities condensed into one over 5 days. So although it is quite intensive, I think the participants actually learn quite a lot, and I think they're actually able to bring back this knowledge with them, and this newfound knowledge, and actually try and implement it in their hospitals.
I think it's a wonderful, curriculum, in the sense that it actually allows them to have some sort of upskilling, and then it's something that they can apply. And if they learn to be better, then they can actually elevate the standard of care likewise in their own localities and their own practice.
I think for this part of the world, there's probably not very many of these courses available, and for people who are trying to learn breast imaging, I think some places, for example Europe or America, might be a little beyond reach for some people. So I think that's how it serves the regional radiologists. Not only that, but also the content that's included in the consideration to put in procedures plus latest such as artificial intelligence into the mix, I think is a good overall value for the radiologists. A very good question. I have been supporting BIE for quite a while now, so it's something to look forward to. And there is this little highlight that you may not think much of, but to meet the other radiologists around the region is also very nice, I feel. The reason why I do it is because I enjoy the teaching process, and I think it's also useful, especially for radiologists around the region, to get to know a little bit more about what to do, different options, what could benefit patients, and so on.
Because I know that it gives it an exponential, effect. That if the more you share, right, the more people who will be doing the correct things, and they can be, agents of transformative care in their own places, which I think is important.
I actually quite like sharing my tips and tricks of how to do some procedures, and I feel that actually when you see them do the actual procedure, you realize that, hey, you can actually improve yourself much more. So if you just correct them a little bit, I hope that they go back to their own countries and they apply it, and they are so much better.
I think they will benefit a lot from this program, both diagnostic-wise as well as intervention-wise. If we talk about diagnostic, you could imagine having viewed a lot of cases within a very short period of time. It is going to be intensive, but they're going to learn a lot from it. And in addition to that, there is introduction to a little bit more advanced or modern or latest tools such as AI, and that can be an exposure that not many may have access to. And interventional-wise, the very fact that for example, the MRI guided intervention workshop, which was hands-on with scanning, with phantoms, that sort of hands-on experience is not very commonly available, especially in this part of the world. So I think they'll benefit quite a lot.
In my case, I think it's really about sharing that how, all of these new technologies, all of the things that we've also gained in terms of experience, we can help other radiologists to, gain that insight and make them also realize why we fell in love with breast imaging.
Definitely motivating to just share your knowledge and just to see them improve as much as possible. Yeah, I really think they're doing such an awesome job. Come to BIE, you'll learn lots. You won't regret it.